Thank you for that kind introduction, and I want to thank the organizers of this forum for including and inviting me, but also making sure that there's a focus on the evidence base and what we know works for both preventing the initiation or progression of substance use as well as providing effective treatments. As was said during the introduction, I work at the National Institute on Drug Abuse, which is a part of the National Institutes on Health, and we are the leading funder for the world's research that focuses on substance use, abuse, and addiction. I've been at NIDA for the last 13 years, and since the first day on the job, I have pushed us to focus more of our research dollars on the problems of adolescent substance abuse. And so I'm going to walk you through a tour de force of a small sample of some of our findings and some of the evidence-based interventions that we have for this important population. I'm going to start by painting the picture. Research indicates that by the time they are seniors, almost 70% of high school students will have tried alcohol, half will have taken an illegal drug, nearly 40% will have smoked a cigarette, and more than 20% will have used a prescription drug for non-medical reasons. We know that adolescence is a critical time of development, socially, biologically, and neurobiologically. And it made the scientist's heart beat a little faster when this morning we had policymakers who had an understanding of neuroscience and the underlying neurobiological pinnings of addiction and substance use problems. It's during the years of adolescence that substance use and the development of substance use disorders occurs. That's in part due to the fact that the brain systems that govern things like emotion, reward seeking, and the experiencing of pleasure are fully developed, while the connections and the systems of the brain that are responsible for long-term decision-making, self-inhibition, and judgment are still maturing. This can lead teens to act impulsively, to seek out novel experiences, and to be very impressionable by their peers. And all of this can create an environment within which they can be drawn into taking risks and engaging in risky behaviors, including the use of addictive substances. What's even more critical is that this is a very important time of neurodevelopment, where circuits that are still forming in the teen brain are particularly susceptible to adaptations and changes that can be long-lasting and that make them more likely than adults to develop a full-blown substance use disorder. But addiction is only one of the deleterious impacts of substance use. We know that adolescents that use drugs are more likely to be involved in traffic accidents. They are more likely to have family conflict and academic failure. We know that they are more likely to also be involved in the justice system, as well as higher risk of suicide, overdose, and death. We also know from a research perspective that unfortunately perceptions of the harm and risk from taking drugs among adolescents are declining across the country. We're not sure what is causing that change, but we believe that shifting landscape around things like legalizing marijuana for medical and recreational use can play an important role, as well as the fact that teens often severely underestimate the addictive properties as well as some of the long-term consequences of prescription drugs like opiates and stimulants. Teens don't understand, because even scientists don't understand, the long-term health impacts of the ever-emerging synthetic drug market, including synthetic cannabinoids that have cool names like spice. So these unknowns lead to an urgency to build a robust evidence base to help us better address these kinds of problems and to understand the underlying health effects and neurobiological effects of exposure of drugs on the brain. I'm proud to say that NIDA will be launching a longitudinal study called the ABCD study that will enroll a large cohort of 10-year-olds and follow them across the teenage years and emerging adult years to better understand what the impact is of exposure of drugs on the developing brain. So teenage years are a critical time for intervention, for prevention as well as treatment. Our research has also led us to develop a robust list of risk and protective factors that can be translated into prevention and treatment interventions. We know that individual factors like early aggressive behavior, family factors like poor parent-child bonding or poor parental supervision, peer factors like substance abuse, and community factors including things like poverty are important risk factors, but that they are amenable to intervention. We have a robust toolbox of evidence-based prevention interventions that have been developed and can be delivered across the full developmental continuum, beginning in early childhood, things like the nurse-family partnership, or for emerging adolescents in middle school, like life school training, can be delivered within families, like the family checkup, or to young and transitioning adults. And these interventions have been delivered effectively to families, through schools, and also within communities. Likewise, there are complicated factors that coalesce to lead to the development of a full-blown substance use disorder. Biology, genes, environment, and all of those provide important targets and indicators for the development of effective treatments. We have an entire toolbox of treatments that are evidence-based that we know also work with adolescents. Treatments that can be delivered to help deal with core components like changing behaviors and attitudes, improving and strengthening families, building and rewarding motivation to change, and helping to build more robust coping skills. These treatments have been targeted toward families, things like functional family therapy and multisystemic therapy, as well as individual interventions, including cognitive behavioral therapy and contingency management. And very important, but often neglected, are ongoing evidence-based recovery support interventions for adolescents and adolescent families. Things like assertive continuing care, recovery high schools, and peer recovery support services. While we have many tools available to us and the need to support more ongoing science to increase our toolbox, uptake of these evidence-based interventions is unfortunately low. Most adolescents do not benefit from a prevention intervention, and only 10% actually of those who have a substance use disorder are receiving any form of treatment. So we need to work together to continue building capacity. Unfortunately, today, the number one referral source for adolescents into treatment is not the healthcare system. It is the juvenile justice system. Adolescents within the juvenile justice system are at extraordinary risk, and I'm proud to say that NIDA has launched a large multi-site research cooperative that is intent on trying to discover evidence-based ways to infuse prevention and treatment into the juvenile justice system. Adolescents in that system, every single one of them, we believe warrant an intervention, either a prevention intervention because of their high risk, or 40% or more of them actually warrant some form of formal substance use treatment. So I'm also proud to say that at NIDA over the years, we've sought not only to build a robust evidence base, but also to provide tools for dissemination. On the NIDA website, you will find the Red Book, and there will be coming a pink and blue book, as we refer to it at NIDA, that list prevention interventions that can be delivered in communities to adolescents, and the pink and blue book focuses on early life and early prevention interventions. I was also honored to be involved in the development of a publication that synthesizes the last several decades of research on treatment called NIDA's Principles of Adolescent Substance Use Disorder Treatment, a research-based guide, which is available on our website and provides a wealth of information about both evidence-based treatment, but also the core principles that underline effective and high-quality systems of care. So I want to thank all of you for your ongoing focus on this particular issue. It is important for us to work together to support research, to support infrastructure, and to ensure that our adolescents are receiving the prevention and treatment interventions that we need. This is the way that we will ultimately improve the health and the lives of our adolescents, their families, and our communities, ensuring not only their futures but our own. Thank you.